Hello, I'm Dr Beth Colby, a psychiatrist from London. In this video I will be explaining some of the common mental health disorders and terminology in them. These will include some from the group of psychotic disorders, mood disorders. What does psychosis mean? Well, I term psychosis with somebody having a sort of a break from reality and they don't know the difference between what's real and what's not real. People can suffer from schizophrenia, and this is a mental disorder where people are psychotic and they have symptoms of delusions and hallucinations. Delusions are fixed false beliefs that are held even with evidence to the contrary, and these are out of keeping with somebody's religious, social or cultural background. Hallucinations can be in any sensory modality, so you can get auditory, which is hearing hallucinations, visual hallucinations, taste, touch and smell. And a hallucination is a false perception, so somebody experiences something but it doesn't come from the outside of their mind, so it's not in external reality. So, for instance, a common one is auditory hearing hallucinations, where somebody may hear a voice or voices with their ears and it appears to be outside their head and it is very real to them. They cannot distinguish that from a real voice that everybody else would be able to experience. And there's also a condition called Schizoaffective Disorder. Now, affective disorders are mood disorders, so affect how people feel, happy, sad, and I'll be discussing them next. But schizoaffective disorder is when people have symptoms of schizophrenia, so the hallucinations and delusions, and the mood disorders, so they could be manic, which is high, and I'll talk about that, or depressed, with the schizophrenic symptoms at the same time in the same episode of illness. Right, now let's go on to mood disorders. So mood disorders are also termed affective disorders. First of all, there's bipolar affective disorder. Now, bipolar means two poles, so people might be very high in mood or very low in mood. So what is mania? Mania is a state of mind where people feel extremely happy, uncontrollably excited, euphoric. They talk very fast, they act very fast. They may spend huge amounts of money on things that they wouldn't normally want or need and things they can't afford. They may be reckless sexually or using drugs and alcohol. They may have amazing schemes and out of character and have an overinflated sense of themselves. And these change from moment to moment. At the extreme end, they also may have some psychotic symptoms. What is hypomania? Hypomania is like mania and has similar symptoms but to a lesser degree. And then depression, there are 10 symptoms. There are two mood disorders that are called persistent mood disorders. One of these is cyclothymia, where people's mood can be mildly elated or mildly depressed, but any of these times when people are like that, they're not as severe to warrant a diagnosis of either bipolar affective disorder or depression. There's also dysthymia, where people are chronically sad and unhappy. This again isn't severe enough to warrant a diagnosis of even mild depression. Thank you for listening. Remember to like, subscribe and write comments.